Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. In this episode, we're discussing an important safety consideration for people living with diabetes, and that is the topic of cannabis use. While cannabis use has become more and more common, with increased legalization in many states, it's important for people with diabetes to be aware of the potential health risks. Cannabis use can affect blood glucose management, it can affect heart health, and it can even affect how someone manages their medications. Due to risks associated with the use of cannabis, the American Diabetes Association's Standards of Care in Diabetes 2025 added two new recommendations. One recommendation is, and I will quote here, advise people with type 1 diabetes and those with other forms of diabetes at risk for diabetic ketoacidosis not to use recreational cannabis in any form. Unquote. The other recommendation is to, and again I will quote here, quote, advise all youth with diabetes not to use cannabis recreationally in any form. In this episode, we're going to unpack the risks and the evidence behind those recommendations. I'm Dr. Neil Skolnik, professor of family and community medicine in the Sidney Kimmel Medical College of Thomas Jefferson University. And joining me, as always, is my wonderful co-host.
Hi, Neil. I'm excited for this conversation. I think it'll be really interesting. I'm Dr. Sara Wettergreen. I'm an associate professor at the University of Colorado Skaggs School of Pharmacy and an ambulatory care clinical pharmacist.
And to provide expertise on this topic, we have Dr. Akturk joining us today. Dr. Akturk is an associate professor of medicine and pediatrics at the Barbara Davis Center for Diabetes at the University of Colorado. He has extensive clinical and research experience related to diabetes and cannabis use and is an active member of the American Diabetes Association. Welcome, Khan.
Thank you so much.
Let's start by learning more about the prevalence of cannabis use. How common is cannabis use in people with diabetes?
So we don't know the real amount, Neil, actually, that how many people with diabetes are using cannabis, or the people are using cannabis are more often or less often in people with diabetes compared to the people without diabetes. However, we did a survey in our center, which we have one of the largest type 1 diabetes centers in the US at the Barbara Davis Center. We asked the people, have you ever used cannabis in the last 12 months? And then we asked questions related to that and, how often and how much and other things. And we asked question about their diabetes management. And the responders that we got, about 500 responders, and 30% of the people responded as that I used one form of cannabis at least once for recreational or medical reasons. So there are different studies and answer the same question. And some people said it's about 30%, some people said about 9-10%. So I think that's it really depends on the area that you are asking this question, and in Canada, in the US, and there are more legalized, and I think that's depends on that where we're asking this question.
While we might not know exact figures, what it tells us in that range is that this is very relevant to many of our patients, and patients use cannabis for lots of different reasons, but without any question, its use is common. And was there any sense in that study, does use vary by age?
We mostly see the younger people are using cannabis more often than older people in general, but it's not an exclusion that older people don't. And mostly the younger people mentioned that they have been using for more recreational reasons, and older people and mentioned that they have been using for more medical reasons.
That's a great point. And thinking about how common use might be, I think no matter how common it is, there are risks associated with the use of cannabis. In my role as a pharmacist, I often think about the risks versus benefit of medications. When I talk with patients, we weigh the pros and cons. Is this something you want to use? But when we're thinking about recreational cannabis, I've heard that conversation change to risk versus risk. And that resonated with me as something that really highlights how we need to present this as healthcare providers, thinking especially with that recreational use versus the medical use, but we're really thinking more of that risk versus risk conversation. So to learn a little bit more about those risks, Khan, what are some of the ways that cannabis use can affect glucose?
So that's a good point, especially in our research that we did with type 1 diabetes. And we show an association that the people are using cannabis have an increased risk 2 to 3 times more to develop diabetic ketoacidosis, which can be, you know, a life-threatening condition. And people are presenting to emergency department with high blood glucose and high ketones. And then we did in our center this study, which was a case control study. It was on the shows association, and it was 2 times more. These people are after the adjusting all the other risk factors. And then we published this one, and then next year after this research we used the type 1 exchange data, which is getting the centers for more than 50 centers data using with the people with type 1 diabetes, and we repeated the same study and we found the same results 2 to 3 times. It increases the risk, and then we started to speculate the reason. Obviously, we don't have any randomized clinical studies, and due to regulation of the cannabis and due to federal regulations and state regulations in many places, and then we kind of speculate then what's the reason behind that association.
And what are some of your speculations about that? I'm very curious.
So there are studies in Australia, in the US, and in pediatric and adult population, and it showed that the people are using cannabis may more likely to miss insulin and for skip insulin, this is the munchies also. The people are eating more in binge eating, and then it can be a problem in people with diabetes. But we were actually focusing on more that the people are having a higher hemoglobin A1C and repeated visits to the emergency departments with the regular cannabis use. And then we were trying to investigate that, and we tried to deep dive into the mechanism and if it should be there is something else other than this. And we were thinking that because the cannabis is actually the can be slowing down the GI system in people with diabetes, and it may be affecting the GI system because it presents most like um, the CHS, which is the cannabis hyperemesis syndrome. It's a syndrome that people are presenting with often nausea and vomiting, and most of the time unexplained. And these people are getting a lot of workup for diabetic gastroparesis, or for other conditions. They get an endoscopy, colonoscopy, or all other invasive things, and most of them comes as a normal. So we were focusing on the mechanistic effect of in this GI system, that the motility in the GI system, probably the cannabis is causing the decreasing in motility, especially in people have sometimes can have a decreased motility due to a long-term diabetes. Sometimes it may be an additional risk factor, or in the people are even they don't have that, but that's something that causes the delay, and it's kind of triggering that vomiting and nausea in these people.
So it sounds like there could be multiple mechanisms actually that range from missed medicines, missed insulin, to changes in gastric emptying, and probably like so many things, all of that contributes to the endpoint. And we know that endpoint of an increase of 2 to 3-fold in DKA is mighty scary.
Exactly, Neil, and also that what we realized that the people are presenting to the emergency department with the cannabis use, and we compare them with the non-cannabis users and with the presenting with the diabetic ketoacidosis. And we realized that the people have very different metabolic profiles. And when they present with to ER, and they both diagnosed with diabetic ketoacidosis, and they both sides have diabetes, they have hyperglycemia, and they have ketosis, which means that beta hydroxybutyrate is high, which they measure the ketones. But the people with presenting to the emergency department with the prototypical diabetic ketoacidosis have high acidosis, and then in the bloodstream their acids are higher, versus the people are using cannabis, they actually have a component also with the metabolic alkalosis. So in the people with using the cannabis, and then they have a metabolic acidosis and the metabolic alkalosis at the same time. It's a mixed acidosis and alkalosis picture, but the metabolic alkalosis is more prominent in the people with using cannabis. So we differentiated that, and we named this as a completely different syndrome, as a hyperglycemic ketosis related to the cannabis hyperemesis syndrome, which very much mimics the diabetic ketoacidosis. So the treatments looks very similar, but the main reason is actually the cannabis use.
That's interesting. And I'm just going to clarify this a little bit for our listeners who are non-medical people, that when you get, and please correct me if I'm not understanding this, when you typically have diabetic ketoacidosis, which is always very dangerous, our body essentially increases the acid production because we don't have enough insulin and we're very dehydrated. The origin of the additional alkalosis, the opposite of acid, is if you're vomiting. Remember, our stomach contains acid. That's how we digest food. And when we're getting rid of all that acid from vomiting, we often get an alkalosis that occurs in people who are admitted to the hospital primarily from vomiting. And that combination creates a very challenging and dangerous situation. It's a challenging position to manage for us as clinicians in the hospital, and it's dangerous for patients. Is that interpretation and explanation correct?
Perfect. Actually, you explained so much more in lay term, which is exactly what it is. So one thing is here is that basically, I think the main difference in the diabetic ketoacidosis, somebody is missing insulin or sick for any reason, because of the high glucose, ketones are increasing, and that triggers the gastrointestinal symptoms like nausea and vomiting, because the ketones causes nausea. But in the other one, and comparing to the cannabis users, and the main trigger is we believe that the nausea and vomiting, that's why we have an alkalosis, because you are losing the gastric acid content. And then that triggers the hyperglycemia and ketosis, because you are sick and you are not able to control the glucose. So I think the pathophysiology is a little bit different, but at the end it looks like a very similar situation to treat.
Now, I hear the comments and I hear a lot about the research that you're doing. And I think a lot of this research has been done in the last few years. When I looked at your publications, there's more and more coming out. And that makes me think about all of this new knowledge that we're just now getting related to the risks associated with cannabis use in people with diabetes. Would you say that there's still a lot we don't know about those risks?
There are a lot of things we don't know, Sarah. Like, for example, why some people are consuming cannabis and nothing happens, and people with diabetes, and why some people are presenting to emergency department all the time. And sometimes people stop cannabis, in a couple months, their symptoms still continue. And, there are some small scale studies depends on the person's weight and the fat deposition, how much the cannabis they use and what type. And also a big question is, we were not seeing that much cannabis hyperemesis syndrome related to diabetes or not in the emergency departments 10 years ago, 20 years ago, or before. And I think it's really dependent on it's very related to the THC level of the cannabis right now compared to before. Now, there are studies show that the cannabis is sold in the US and Canada right now is so much more THC than many years ago people were obtaining from different sources or different places. And that's probably related to higher THC levels because we haven't seen this with the CBD only products so far, at least for our patients with diabetes. It may be a correlation with the THC level, but we still don't know why some people are having when some people don't. There are so many things that needs to be researched.
And I know one of the things that people need to be concerned about, even with CBD, is that not all CBD products are pure. And there are many CBD products that contain, sometimes listed on the ingredients, sometimes not, THC. And so it really is important for people to be aware of that.
That's such an important point, and I'll jump in as a pharmacist there, but you're exactly right, Neil, that these products, especially when you're thinking about recreationally used products, are not regulated. And so it's really interesting to hear that there are different levels of THC in cannabis products at this current time compared to many years past, because it's not regulated. And so how would we know that otherwise? So it's interesting to hear about the changes that happen, but it's also important consideration when we think about safety to know you may not know exactly what's in your product. Some recreational products might say they can turn a certain amount of THC and they might have less or might have more, or might have what it says. And so it's hard when you don't really know what's going into the person's body too. Neil?
I think that's such an important point, Sarah. And we're familiar with recreational use, primarily, kind of as you said, in younger people. I see a lot of older people who, whether it is because of arthritic pain, diabetic pain, hear from a friend that some sort of cannabis use or CBD might help them. And that's a group that also might be insulin deficient because they've had diabetes for many years, and also important for them to be aware, as Sarah said, that there's not clarity about what they're getting, and there's potential dangers for what is sometimes sold or told to be a benign product.
I think that's the main thing, Neil, is that people needs to know about the pros and cons and the possible risks. And I always think that we have alcohol for many years, and we know that the excessive amount of alcohol use and then all this legal or health care issues related. But I think then when it comes to the cannabis, and some patients are self-medicating in quote unquote themselves in terms of the recreational use as a for a medical reason, and sometimes people think that the medications have a lot of side effects, but the cannabis doesn't have any side effect at all, and it can be consumed as much as without any problem. I think that's something that needs to be better understood and better explained to the users. And then when people are consuming cannabis, they should be very much better well informed about the risks and benefits.
I think that's a really good point. Now, is there an effect, do you feel, of cannabis on self-management behaviors?
I think that the most people are sometimes, in my clinic, people are using for pain, people are using for, mental health related things or to sleep and or any other things like that. I think that sometimes, one of the friends suggested or something, somebody was getting for a medical reason, and because of the different things and people are reaching these things, and using different reasons. But I think they should always talk to their primary care physicians and the other consultant physicians, whatever the medical problem is, and then they should be getting their opinion about the using a cannabis for that medical condition.
I am so happy to hear you say that because I can't tell you how many people I have seen who have been told incorrectly that some cannabis related product might help there. And I could go through a list of things right now that for which there's no evidence that it helps. And while there might be some areas where it might help, I think that it is so important to run this by your primary care clinician or endocrinologist so that they can give you input about whether this makes any sense at all, might make sense, or is simply a bad idea. And really having uh, uh, your healthcare team involved is critical to these decisions.
Absolutely. One example you're making me think about with that comment, Neil, is how I approach patients who bring up herbal products. This would maybe fit a little bit into that category. A lot of times they hear from a friend or they've tried something and they're like, I feel so much better and it's natural. And so I don't need to worry about any potential side effects or any harms to me or any drug interactions. And we have to pause that conversation and say, okay, actually, let's look at the evidence. Let's actually look at the medications you're taking and what we know about drug interactions for this particular product. And, sometimes we find a couple interactions, sometimes I find 20. And so it is really important to have those conversations with your healthcare team. I do think sometimes patients are hesitant to bring up a conversation about cannabis. Con, do you have any tips for patients who might feel uncomfortable bringing this topic up with their provider of how they might approach it or what your response has been as a provider? I'm sure it's only supportive.
I'm always asking as an open-ended question, and then I'm always trying to say that I'm not here to judge to anybody for any reason, and I'm here to help and for all my patients for their cannabis or any other things. And so I think the providers should be asking open-ended questions and without a judging manner, and then try to get the answers properly. And sometimes, unfortunately, we get some resistance if we think that their medical problems are related to cannabis, like frequent ER visits. We have some people are visited the ER like 30, 40 times a year, literally. And then they are also getting frustrated and they are leaving one ER, going to another ER because they are not, satisfied with the answers in the other one. And sometimes these people think that, oh, there is something going on with them that no one else can find it, or they have a diabetic gastroparesis that they have, because it's a common thing that people are thinking that, oh, I have diabetes related issues because of that's why I'm vomiting. And sometimes it takes time to people, to convince the people, and sometimes they need to be well informed, and it takes a couple visits to consider that.
Now, I have a question in a completely different area that I have been asked by patients about, which is the effect of cannabis on lung health and the effect of cannabis on cardiovascular health, which is, of course, a concern because people with diabetes have elevated cardiovascular risk to begin with. Is there any information that you'd like to share on those areas?
I think there are published data for the people are consuming very high doses of cannabis and some synthetic cannabis that can have some acute cardiac issues. But we don't know the long term. I think we need more research to see its effect in the long term for the cardiovascular health.
Yeah, that's a great point. I think we think about smoking cessation often in patients when we're thinking about heart health, more thinking about smoking cessation for tobacco products. But there is some evidence that the particles from smoking cannabis can have cardiovascular risks as well. So important to think about those risks. And certainly if you're someone who's using cannabis or thinking about cannabis, to bring up those concerns with your healthcare team to get those questions answered. Absolutely. Now, thinking about our conversation today, we have covered a ton of information, and I imagine people might leave this podcast listening session and have some remaining questions. I'm curious about where you would recommend someone to go to learn more about this topic. Con, I'm curious if you have any recommended resources that you could share and that we can include in our show notes.
And I always suggest for my patients to follow the information based on the societies like American Diabetes Association, or discuss with their physicians about things, because now people have the internet and they can access to so many things, and then not necessarily this information is science-based. So they should always seek the behind the truth, always look for the studies, and then always look for the information that where the source is.
That's so important. Khan, we only have a few minutes left. Any final thoughts that you'd like to share?
I would suggest that the patients who use cannabis, and they should be open and to with their providers, and they should mention that. And if they have symptoms of recurrent and often nausea, vomiting episodes, and if they are going to emergency department a lot for different reasons, and they should consider the cannabis use. And sometimes if they don't think about it, they cannot find a solution, because it's very much misdiagnosed with the diabetic gastroparesis. We mostly see the diabetic gastroparesis as a cherry on top for the diabetic complications. This is one of the latest complications in diabetes. We mostly see people develop retinopathy or nephropathy before, kidney issues or eye problems before developing the diabetic gastroparesis, which means that your stomach is not digesting things properly, and things are delayed, the motility, but the cannabis can do that. So if somebody has diabetes in the early stages and their control is relatively well, and if they are having this gastrointestinal symptoms and they are consuming cannabis, they should discuss about this with their provider.
Very important. Sara, your final thoughts.
My final thought is coming back to that consideration of risk versus risk. When we think about recreational cannabis use, I'm thinking about the harms associated with it. We heard a lot of things today: ER visits, diabetic ketoacidosis, hyperemesis. All these things are scary, not ideal to experience. And so really going back to those ADA standards of care and diabetes recommendations, stay away from recreational cannabis in any form, following the guidance that Neil said at the beginning of the episode, thinking of that risk versus risk.
So important. Understanding the risks of cannabis is an important part of managing diabetes safely. There's a lot of aspects to excellent management. This is one: staying informed, having open conversations with your healthcare team is always important in every area of decision making with diabetes, and so too in this area. If you have questions, we really encourage you to talk about this topic with your healthcare team. If you are a parent and have an adolescent or young adult, this is an area where it's so important to have open, honest, non-judgmental conversations with optimal health outcomes as the goal of those conversations. Thank you for listening today. If you have any thoughts you'd like to share, leave us a voicemail by calling 703-755-7288. Again, that's 703-755-7288. We hope to hear from you. For the American Diabetes Association, I'm Dr. Neil Skolnik, and thanks so much for listening.